Hi, I'm Dr. Rasya Dixit. Men are equally concerned like women and they don't want to get any fine lines or wrinkles. But unfortunately, because we always work with lights, whether it's your laptop or your mobile, we are all frowning all the time. So we are developing more lines around your brows, around your eyes very easily. And even so much more if you are exposed continuously to the sun, because the sun also causes the loss of collagen. So you get more lines because of that. So the answer is simple. Make sure that you're using sunscreen so that whenever you're going outside, you don't lose any collagen. Make sure you're eating healthy and quit smoking, because that again, eating healthy and quitting smoking again increases the amount of collagen formation in the skin. Make sure you're using a good retinol at least 2 to 3 times a week once you're over the age of 35. That is going to increase the dermal collagen formation. But if your lines are already forming, you may need a little bit of help from your dermatologist in giving you a little botulinum toxin or neuromodulator to help the lines from develop. Treatments such as lasers, platelet-rich plasma, microneedling also help a long way in treating fine lines and wrinkles. But to know what is best for you, always consult your dermatologist. We have to remember that sunscreen is a very important part of skincare, but sunscreens don't prevent tanning all the time. So they do prevent your skin from getting damaged because of the sun. They prevent sunburns, but they may not prevent 100% of tan. So if you are worried about tanning, make sure that not only you put on your sunscreen, but you will also have to look at taking an oral vitamin which will prevent pigmentation. These are oral antioxidants like lycopene, pycnogenol, glutathione, which can be given as a vitamin supplement, which can prevent the tanning as well. And you have to go for some avoidance of the sun and try to avoid during the peak sun exposure hours between 12 o'clock to 4 o'clock, so that you don't spend too much time in the sun there where you are going to get more tan. If you do get a tan, there are tan removal creams which are available, tan removal treatments which are available, which can remove the tan. But more simply, avoiding getting tanned is easier than removing tan. Whether it is men or women, once you have sensitive skin, you have to look for products which are safe for sensitive skin. When it comes to face wash, look for a pH balanced soap-free cleanser. These are going to make sure that the skin barrier is intact even when you wash it. So if you have sensitive skin, the skin barrier is impaired, so your skin gets more dehydrated easily, gets more flaky easily, gets more red easily, gets more itchy easily. So look for products which have the title pH balanced, have the title soap free. Whether it is a face wash or a body wash, look for these titles. Second is to buy a bland emollient. When I say bland emollient, it does not have any perfume, does not have any color, because those products may end up irritating your skin. So look for these products. Your doctor may prescribe you gels or moisturizer creams which have these products which are going to soothe your skin. And very, very important, this sensitive skin is very sensitive to sun as well. So use a chemical free, mineral based or physical sunscreen which is going to keep your skin protected from the sun. Sensitive skin people may also need to be seen by a dermatologist in order for them, if the barrier is impaired, they may need some steroid cream or non-steroid creams to be prescribed to them to repair or restore the barrier. They may need oral supplements of ceramide, of hyaluronic acid, of omega-3 fatty acids, which are going to help their skin to come back to normal as well. Remember, in people with sensitive skin, they don't do well with actives like retinol, glycolic acid, vitamin C. So don't go and buy these serums and start using them on your own, as you may make your sensitive skin much worse. And always remember that physical exfoliation is also very, very bad for people with sensitive skin, as it disrupts the barrier further. The dermatologist can advise you further on what are the better products that you can choose from. Please speak to them. Men do get a lot more acne than women, and the reason for it is simple. They have larger oil glands, they have lots more testosterone, both of which are going to stimulate the formation of acne. Men do tend to scar more as well, unfortunately, and this is important for them to understand, especially because scarring is very difficult to treat. Acne is transient. So acne is physiological, meaning most of us are going to get acne when we are teenagers and it is going to disappear. But the scarring which is coming from acne, that tends to become more long term. So if you have acne and you are having scarring, that means depressed scars, or your family member also, like your parents had tendency of scars, then you may develop more scars as well. So it is important, if you have scarring, to take treatment early. So just not neglect it saying it's a normal acne scarring or acne of men. So this is very important. And yes, we are seeing a resurgence of adult acne in men as well because of the lifestyle, because of the stress, because of the sleep habits, smoking. We are seeing acne which come back in people, men who are there in their 20s, and late 20s and 30s. And that has to be treated with oral isotretinoin, which is a medicine which has to be prescribed by a dermatologist. So yes, if you have acne and you have scarring, or if you have acne which is late onset, do speak to your dermatologist. Body odor is very, very common in men, but did you know that the sweat actually is odorless? Yes, it is the bacteria which are breaking down the sweat, which are there present on our body, which are going to cause the sweat to start to smell. So if you have body odor, the first thing to do is to ensure a proper hygiene. This means having a shower twice a day. You can use antibiotic containing body wash or soap, which is going to reduce the amount of bacterial load on the skin, and that is going to help to reduce the smell as well. Drinking more water, that is going to make the sweat less concentrated and flush out the toxins, will help as well. Some foods like onion and garlic tend to make the body smell more as well, so you can avoid those in your foods if they bother you a lot. Making sure you're practicing good hygiene by wearing fresh laundered clothes every day, that should help to a great extent as well. If you do all these things but still the body odor is persistent, you can look at options to treat the excessive sweating by using antiperspirant roll-ons, which are prescription based, antiperspirant tablets, which are again prescription based, and even neurotoxins like botulinum toxin to reduce the amount of sweating on the underarm area or particular parts of the body. There are many options, so don't lose hope. So you can definitely consult your dermatologist to know more. These are the many questions that we've had about men and men's skincare. I hope we have answered many of them for you. If you still have questions, keep them coming. Leave them in the comments below and we will get back to you.